Nurse Ratty, the radical nurse. So, good morning, everyone. It is me, Nurse Ratty, and welcome again to Nurse Ratty. And we're going to talk about the continuation of the part two for the assessment form. So, right now, you're on page two. This is the nutrition and metabolic pattern. So, I have here diet. I indicate here soft diet. Food intake. Is this person going to be eating like three times a day? 3 times a day of meal. And of course, appetite, is it poor or good appetite? Is there a nausea or vomiting is present? Yes, there is a presence of nausea and vomiting. Then the supplements, non-fluid intake, 1.5 liter a day. The height is in centimeter, 165 centimeter, with the weight of measured in kilogram. And of course, we going to calculate also the BMI of 28.3. Now for the food eating discomforts, we can tag it. By the way, just below this is hematemesis and coffee ground vomitus. So if you're going to be using the PDF file, simply click this one and it will route you to the web link. So for example, for hematemesis, hematemesis is this is an illustration for hematemesis. So let me show you here. This is a vomiting of fresh red blood indicating active bleeding from the upper GI tract. Okay, that is hematemesis. Let's move on. The coffee ground vomitus. So that coffee ground vomitus is vomit with dark grainy appearance indicating partially digested blood from the upper GI. So that's the it gives you already the idea. Okay, not everything is indicated because I know that this has been discussed with your clinical instructors. So nutrition state, I could is the person well nourished? Well, I can change this one to poorly nourished because of poor appetite. Is the person obese or cachexia? And of course, for the mouth, we're going to be assessing the mouth. So we can check for pallor, cyanosis, dryness, or lesions. So I indicate here pinkish. So for example, if my decision is gonna be cyanotic, so I'm going to click this one, but there's a box here. You can just click that one and give you an idea about cyanosis. So cyanosis or mouth cyanosis is a bluish discoloration of the lips or oral mucosa caused by a low oxygen levels in the blood. Same thing of the pallor, okay? Now, we also have dryness and crack. We have also lesions. And for the mucosa, we have pinkish is normal. We have pallor and cyanotic. So, same thing regarding mucosa on a cyanotic basis. Okay? Still low oxygen levels in the blood. Basta magka-blue-blue na siya. And of course, we have some tongue. We have midline for normal. And we have right or left deviation. So, let's explore on that one. So here's an example for right and left deviation. So for a tongue deviation, shift from one side when protruded, usually indicating hypoglossal nerve weakness or damage. Pag dawal sa dila, then kalit na din mo to sa pikas, then there is a damage of the hypoglossal. Okay? Or there's some weakness. Next is, let's have a look under the tongue, is fasciculation. So let's click that one and to give us an idea how the fasciculation looks like. So the tongue fasciculation is an involuntary twitching of the tongue muscles, often indicating lower motor neuron or hypoglossal nerve dysfunction. So pag diwal sa iyang dila, and then gakalit lang siya twitch-twitch yaha, well, that is fasciculation. Now let's move on to the next. It's gonna be the pharynx. So midline is the normal. Then we have the right and left deviation. So let's talk about the pharynx. So let's click on that one to give us an idea also. So right and left deviation. For example, the uvula deviation here. Yeah, nakikita mo. Instead of it's gonna be in the middle and straight, it's deviated. So uvula shifts to the one side, often indicating cranial nerve dysfunction or weakness. Okay, and also let's move on to the crack. There's also crack. So pag check niyo sa mga pag say then tanaw ninyo ang iyang uvula, and there's some crack there. Okay, so dry fissured uvula often due to dehydration, mouth breathing, or throat irritation. Lamit ka nang magtulog ka pag matanin mo na malaka imong tutunlan. So there you go. You are a mouth breather. Dili ka gagamit sa imong ilong. Okay, let's move on. Now let's move on to the next. We have the lesions also. So there you go. So the lesions dito makikita nito na yung mga pus diyan, na yung mga samad. See? So sores, ulcers, or abnormal tissue growth on the uvula, often caused by infection, irritation, and trauma. Now let's move on to the next. So we're done with the cause we're gonna go to the tongue. So let's have a look if there's a deviated tongue. So yung so that's was that tongue? I'm not sure really. We already discussed this one already. Sorry about that. So for the gums, cyanotic. So that means poor oxygen. So let's have a look about lesions in the gums. So pag observe nimo sa ilang baba, sa ilang gums. So sorry, it's still loading. So there you go. So na yung mga puti-puti siya diya. And of course, na yung mga samad-samad. So sores, ulcers, abnormal tissue on the gums often due to infection, trauma, or oral disease. Okay. Next, let's have a look about the dryness and crack, so that at least you have an idea how, a closer look for gums who has some cracks and dryness. So here you go. Okay. So yan, na makikita niya dyan. Mga little bit crack there on the gums, gum lines. Okay, so there you go. Dry, fissured gum tissue often caused by dehydration, mouth breathing, or okay. Now I forgot what it pour there. Poor hygiene, especially for dental hygiene. Okay, let's move on to the next. So we're done with the pharynx. Now let's talk about the neck. So I indicate everything almost like on the normal midline. So let's have a look at the next. So we have thyroids. We can click on enlarge. So how does it look if the thyroid is enlarged? So here we go. So here we go. There you go. So yung thyroid mo parang there's like a knot there. Lumaki talaga. So there's an increase in size of the thyroid gland, often due to iodine deficiency and hormonal imbalance or thyroid disease. Next, let's have a look for under cervical lymph node. We have the lymphadenopathy. We're gonna click on that one, so it will really give you a big idea. Like there's a lot of nodes kasi sa atin. So this one is gonna be like enlarged thyroid lymphadenectomy. So ma-feel ka na mo dinhi like that. So swelling of the thyroid gland accompanied by large lymph nodes, often indicating infection and inflammation or thyroid disease. There you go. So if you see that, you can click that one. But for this one, I don't think it's lymphadenopathy. I don't think so. So if there is if the patient says there's a little bit pain in my neck, then I could click tenderness, but I'll just click that unclick that one and check that one. So we have the others here. We have the neck rigidity. What is neck rigidity? Is stiff neck. So parang maglisod siya og look left or right, ma-move niya yung neck. So he has to move both his body. Then that's neck rigidity. So this is a stiff neck of the neck with a limited movement, often indicating meningeal irritation or severe muscle spasm. I have this before, but anyway, as in more like robot. Next is we have the skin. So I'm gonna put there since this is a leptospirosis case. I'm gonna indicate here jaundice. So to give idea how does jaundice looks like. So we already heard about the jaundice, but it's something to do about yellow. Okay, so skin jaundice is a yellowish discoloration of the skin caused by elevated bilirubin levels, often indicating liver or bile duct dysfunction. So makikita mo dito yung normal and ito yung nag-yellow na because of the increase of bilirubin. Next, let's move on to the next. We have the dusky skin. So dusky from the word dusk. Para siyang zombie na siya, indication, just getting there. So it's a darkened or grayish skin tone indicating poor oxygenation or reduced blood circulation. So aside for the bluish color, that gives us a sign for poor oxygen, dusky is like really pale talaga siya. So parang dusky dust. So siya mo siya natabunan ng dust. Okay, let's move on. So we have also cyanotic. So cyanotic is kind of a little bit different. But again, when you say cyanotic, blue. So it's a bluish discoloration of the skin caused by inadequate oxygenation and of the blood. So pwede siya mag-manifest sa imong tongue, sa imong skin, and of course, usually makita gina mo sa absorb mo sa hand. Okay, so let's move on. Where are we right now? So we have flush skin. Oy, nag-flush siya kay dayang crush. So that means the reddish. Okay, namula-mula siya. So here we go. So here we go. Flush skin is a red or warm skin caused by increased blood flow, fever, or inflammation. Okay, that's flush skin. So I check jaundice because this is a leptospirosis. But what about this mottled here? Anong itsura niyang mottled na yan? So let's click that mottled. Okay. So here we go. Mottled is para siyang a little bit na spiral sa skin, nakita nimo. Just like this. Skin mottled is a patchy, irregular discoloration of the skin indicating a poor circulation or shock. So there you go. Once makita ka na, don't panic. So that's indicate a poor poor circulation lang siya. Iba yung poor oxygenation and iba din yung poor circulation. We're talking about the blood. Okay? So let's move on to the next. What else we have here? So we have firm. We also have dehydrated skin. This is very interesting kasi ang uban dili ka-check aning dehydrated ang skin. Especially if you look at the lips of the patient and makita ninyo na naay mga laway diya pag open siyang mouth kapilit ang laway and dry ang lips. That's already a sign of dehydration. So this is one here is a dehydrated skin. Manotice ninyo na mga puti-puti din ha. And ang lips niya is dry. So lahi ang dry skin and lahi ang dehydrated skin. So there you go. Makita niyo diya. Look at the lips, the cracked lips. That's already a sign of dehydration. So dry, rough skin, poor elasticity, indicating fluid loss or dehydration. Now, let's move on to the next. We have temperature, warm. O syempre, pag cool siguro, that's still okay, but still depends on what they're talking about. So, parang warm, like, I'm really sorry sa background music, background sa akong silingan because I don't know, they just like to bombora stuff. But anyway, let's move on to the moisture. I'm going to tag here dry. It's not really that oily, but dry lang siya. PTK. So we have other check mark for skin. So we can have PTK. We also have ecchymosis. So let's have a look about the ecchymosis. So for the ecchymosis, we have. Sorry, still loading up. So it's a purple and bluish discoloration caused by bleeding under the skin bruise. So it's also almost similar with hematoma. Okay, we also have what you call edema. Now, panghupong, that's the Bisaya term edema. So there you go. So nanghupong siya. Sinanotice niyo na upupong siya. So edema is a swelling caused by excess fluid trapped in the body tissue. But this one is one-sided man siya, so there's another term for that. But let's do this one by one. When you talk about pitting edema is when you press a particular hupong, pag press mo sa yung finger and pag-release din mo in less than 2 seconds, wala pag slowly pa siya makabalik in 2 seconds, then that's already a pitting. So we also have the pedal edema. So it's a one side, it could be left or right. So as you can see here, it seems it's still black. So there you go. This is a pedal edema, swelling of the feet and ankles caused by a fluid accumulation in the lower extremities. So ankles and feet are swelling. Okay. Ankles and feet are swelling and of course one-sided. Okay, so what else we have here? I think that's all we have. So let's have a look also on the wound dressing. So there's no wound dressing done. Intravenous fluids, wala naman sad, so not applicable. For other pertinent data, I will tag there non-applicable. For the elimination patterns, I indicated here once daily normal stool for usual bowel, last bowel movement, kasi siya last na libang, I will indicate the date. And of course, we have melena, hematochezia, and of course, any problem with the hemorrhoids, observe sa yung tae, it can be dark yellow urine, decrease in output, as expected for leptospirosis case. Now for the abdomen, this is very interesting. We are still on the second page, ang dami no. So for the second page, we're going to talk about the this following here. So for the abdomen, we have superficial stria scar. So let's have a look how under general, basig matingal lang mo inyong i-click yung number 1 kay ang nakabutang ra ba din kay superficial veins basig normal siya. No, it's not normal. This is what you call the abdomen superficial veins. Visible veins on the abdominal surface often due to skin increase and venous pressure. So that's the abdominal superficial. Gapanggawas din na yung vein. Okay? Now let's move on to the strea. So we're gonna click on this one, and then of course the strea, just click this one ha, and then ipakita sa mo. So for strea we have example here. Let me just, oh, there you go. So makita ninyo diya sa abdomen ay mga color din na mga lines. So that's a linear stretch marks on the abdominal skin caused by rapid stretching, commonly seen in pregnancy and then weight gains or hormonal changes. Okay? And labi na pagkadamgaw si kalyang bata, samo to sana makita sana nimo siya. Okay? Pero slowly mawala ra siya, guys. Don't worry about it, girls. Okay, so let's move on to the next information here. We have symmetrical and asymmetrical. This is interesting. So for the abdomen that is asymmetrical, so di ka siya nga so what is it? Asymmetrical. So there's a symmetrical, which is normal. We also have the asymmetrical. So asymmetrical is this one. Makita nyo gapatagilid ang uban. Okay, so in short, kung nasuludan na is organ. So therefore, there's something wrong with the organ. Siyempre, basig tako kay siya. So uneven or irregular abdominal contour, possibly indicating masses, organ enlargement, or hernia. Now let's move on to the next. It's gonna be what do we have here? We have asymmetrical. We also have globular. So globo, from the word globo, bako, so parang globe. So for globular, this is an example for globular. Ayaw pagtanong mo sa ako kasi normal rin ako ha. So we have a globular, dako kintihan murag butiti na murag naay limatok or sa ba, or some kuan bak sa sayang tiyan. So anyway, abdomen globular is a rounded bulging abdominal contour often seen in pregnancy, obesity, and fluid accumulation. And of course, pasig siguro schistosomiasis, no? Well, anyway, so there you go. If you see this one, you can tag this one as globular. Now, after the globular, we also protuberant, and we also have scaphoid. So let's have a look about the scaphoid. Scaphoid. So for the scaphoid, I'm still loading there. So here you go. Makikita niya dito para siyang a little bit sharp. No, not really sharp, pero medyo siya like gamay ang tiyan, pero parang yun makita niyo din ang bukog. So abdominal scaphoid is a sunken or hollowed abdominal contour often seen in malnutrition or severe weight loss. Okay? So kani siya, okay na siya flat, pero kani siya kay gilubong gyud. Like cases like Somalia, especially sa mga lubong gyud ang tiyan ba dili flat. So there you go. Especially, I think this also can be fun for anorexia nervosa patients. Okay, so what else do we have here? So we have normoactive. So I tag my patient normoactive. Tympanic, so fluid wave, so organomegaly, enlargement of the organs, and of course we also have bladder distension and direct tenderness. So I'm gonna uncheck this one because I don't think you mentioned about direct tenderness. Yeah, there's a direct tenderness, especially for leptospirosis. So let's talk about the bladder distension. So let's have a look. Bladder distension. So distended bladder. So expected ani medyo siya maburot din na, especially pag wala kaihi. So there you go. For bladder, here is a bladder na puno kay tanan. So mag-expect ka na mo burot na din ha. Okay? Distended bladder ni siya na case. Visible or palpable lower abdominal swelling caused by urine retention in the bladder. Muna siya ang tawag bladder distension. Then what else do we have here? So I'm gonna put it no currently due to weakness. Leisure activities, watching TV, cardiovascular status, no chest pain. So there you go. Feel free to explore our page 2 sa ating nursing assessment form. That's it for now. Thank you so much for watching. This is me, Nurse Radi. I hope you enjoyed this short tutorial. Have a beautiful day. Nurse Radi, the radical nurse.